All right, so Leah is 33 weeks pregnant, and we are going to perform some adjustments today, and this will really help the delivery process, as well as kind of making it a lot easier while you are pregnant with this extra weight hanging from the belly. So our first adjustment is going to be within the sacrum, and we're going to do it on this table. If I can have you on your side, facing me. Go ahead. Right there. Perfect. Let's come slightly closer. That's great. I'm going to make sure we don't put any pressure on the belly. And tell me how it feels on your sacrum when I palpate. So here's your S1, here's S2, and here's S3.
More S2. Feels
Okay.
a little bit more uncomfortable.
How's S4?
That's okay.
And how's S5?
That's okay.
All right, so let's go back. Here's S1, and here's S2. That's where you feel most of the pressure, right?
Yes.
Okay. Relax that lower leg. Make sure you're not controlling. So right there, I'm going to give it a easy push. And there he goes. That was a good movement. Let's go over to the knee chest table where I can adjust your T4, your upper back. Go ahead, face down. And allow the abdomen to drop all the way. That's good. And here's T1, 2, and 3. We'll be adjusting T3. R. Make sure your shoulders are loose. And that was a good movement. All right. When you're ready, we'll go over to the chair, and I am going to adjust your neck as well.
Yep.
And right over here, this is 7. Yeah, and this is T1. You feel more pressure on 7 or T1?
7.
Right in there. Okay, so let's go under it, lift it, and set it forward. Chin down. Try not to push yourself forward. I want you to kind of feel like, yeah, you can hold the side handles. And it's right there. Okay. I think that was a good movement. All right, we're all set.